This is the situation in rural town of Samburu County. Residents carrying out their businesses oblivious of lurking danger as they violate the social distancing rule. Police officers traversing the town, calling on residents to avoid gatherings and stay at home where possible. A majority opposed to the dusk to dawn curfew imposed by President Uhuru Kenyatta on Wednesday, saying it would hurt their businesses.
Rais alisema kitu ya maana. Mimi tunataka kuambia serikali ni kwamba waache kuambia watu wafunge kazi, lakini mikono tunaosha na tunaona kama kawaida. Vile serikali ilitoa sheria, hiyo sisi tunafuata. Ugonjwa hakuna mwenye aogopi ugonjwa.
Tunategemea malori ambazo zinaingia town. Tukikosa kufanya kazi ya lori tutakula wapi?
Lakini sasa hata ukifunga, sasa hii imeingia mpaka kila mtu inasikia imefunga pande hii. Na hapo awali kama ingefungiwa awali, sasa hakuna tena ingekuwa sasa hii. Kama ndege zingefungwa huko.
The residents are calling on the two levels of government to supply food to residents for effective management of the spread of the virus.
Kwa sababu kila sehemu iko na watu zaidi ya familia 500 au 1000. Waende watoe usaidizi ya maji, sabuni na kuelimisha watu kwa sababu hawajui. Umemwambia afungiwe akae kwa nyumba asitoke na watoto wake, atakula nini? Ataenda wapi ndugu yangu?
Na hata yeye mwenyewe anajali kwa sababu kwa vile amesema abunge, hiyo ni sawa kwa sababu kibo ni mbaya. Hakuna ile mtu anataka akufe. Kukufa sisi taisha na dunia la kwaje.
Nasio Kware, Channel 1 News.
Cancer is listed among top 3 killer diseases in Kenya. Statistics indicate that 33,000 people die annually as a result of the disease. Cancer Survivors of Kenya's Secretary Jane Francis Angalia, who has been battling with breast cancer for almost a decade, says that many cancer patients die as they are forced to forgo treatment owing to the high cost of accessing healthcare.
To control it, they have to do another 18 sessions, and at that time they were paying 300 per sessions, over and above the 3 million I was selling for chemo, radiation and surgery. So 18 sessions times 300,000. Imagine. So most of them do 1 or 2 and they stop.
She is now calling on the government to come up with initiatives that focus on lifting the burden of cost incurred by cancer patients, especially at this time that the country is facing an economic downturn.
Personally, according to me, cancer is worse. You know, people are thinking corona is worse. For me, because of what I've gone through and what I've seen so many others going through, it's even worse.
She also says that the mismanagement of the National Hospital Insurance Fund affects many cancer patients who depend on it to cater for the cost of their treatment, and is calling on the government to intervene.
As for NHIF, because that's the only body that I really feel can be able to help cancer patients, I have no idea. I don't know what to say. Because every day we are reading bad things about the NHIF. We don't know the money that we contribute, where it goes, because definitely, of course, we read in the papers, it's eaten. People need to have a conscience.
At the same time, the Kenya Association of Radiologists signed a deal with General Electric Company aimed at providing world-class technology and equipment for cancer treatment and diagnosis, as well as providing adequate training of professionals.
It is very useful because many times as a specialist, when you want to get further education, you have to go abroad. You have visa limitations, you have cost implications. There's a barrier of access to even attending these fora. So a setup where GE can utilize its networks to bring in international speakers allows a larger pool of local radiologists to learn from world-class diagnosticians.
Accurate diagnosis is a result of quality imaging services done with quality technology and competent healthcare professionals.
Meanwhile, a group of youths within Homa Bay County have formulated a plan to help the elderly and people living with disabilities stay at home and be safe in the wake of the outbreak of coronavirus. The group, operating under the umbrella Unseen Hands, will be working with well-wishers who have donated their motorcycles to be used to ferry essential goods at the doorsteps of these vulnerable groups.
It's voluntary actually. we decided to contribute some little money within ourselves. Then again, we have got people who have given us the free bicycles. Other people have even donated to us. Someone gave us a vehicle if we need, because so far they are staying at home and they don't need these bicycles.
For Channel 1 News, I'm Safin Acheng Oma.
Naitwa Julius Owino, nafanya hapa kazi Tao.
So unakula wapi?
Okay, mimi natoka kwa nyumba kama nimekula. Juu hapa Tao hakuna mahali naweza kula. Hatuna hiyo pesa ya kufanya nini, ya kuingia hapa Galito chukue takeaway.
Kitaka kukula, mimi nateremka mpaka huko Modhuro. Modhuro huko ndio tunaenda, tunakaa chini mzuri, tunakula, na hata kwenyewe tunakula tunaharakishwa. Hawajajifunika hata. Lakini maji ya kuoga mkono wako nayo. Sanitizer ndio hawana.
Kwangu niko satisfied because they are a bit fast. Kwa mask sijaona anything about mask ama gloves, but in terms of fastness wako sawa.
Public service transport in Naivasha town was disrupted after operators defied orders to leave the central business district for Naivasha Stadium. According to Naivasha Sub-County Commissioner Mathia Mbogo, anyone who defied the order would face the full wrath of the law. He termed the current situation as serious, adding that the operators would have no option but adhere to the guidelines set by the government. Lakeview MCA Karanja Mboro, who also chairs the Committee on Disaster Management in the County Assembly, said that only 2 vehicles would at any time be allowed to the main terminus to drop passengers, while all the other matatus would have to operate from the stadium.
Ni aibu kwangu kuja kushika mtu pale na mko hapa kwa biashara. Usibidia kwa hapa. Anataka kufika hiyo kiwango. Tuko na enforcement officer. Please stay kuongea sana because nikiongea sana ndio kwa nini ile nimeona kwanza ambayo ni kuja kuitwa kuambia the chairman wa 2NK, chairman wa Kasese, chairman wa nini amekataa kutii amri kwa bodo nyingine. Bwana kiu hiyo ndio nataka kusema.
Meanwhile, as harsh economic effects of coronavirus continue to hit different sectors of the Kenyan economy, leading to closure of businesses, private employers have been urged to consider offering social support to their employees during the season of the pandemic. Dr. Moses Mwangi, a vaccinologist, says that while President Uhuru Kenyatta outlined useful measures to keep the economy going, such as tax relief to small enterprise businesses and reduction of bank lending rates, the pandemic, whose season remains indefinite, will have serious economic effects. He pleaded with employers to support their employees, pay rent, and meet basic necessities such as food.
As employers, we need to go a step further. During this pandemic period, we need to see how do we support our people. Some of them may be casual laborers, but now they have no work to do, yet they still need to eat.
Elsewhere, Modhuro Market, which is the biggest market in Narok County, has been closed after traders defied the national and county government's directive to close all markets within Narok. Police officers were deployed to enforce the order after it emerged that the traders were not adhering to the Ministry of Health directive on social distancing. However, the traders protested the move, saying they were not given ample time to close. Narok County Commissioner Samuel Kamiti said the market closure will remain in force until further notice. He further banned border operators from accessing Narok town.
Kuanzia saa hii iwe ya mwisho. tuone ya kwamba tumekaa mbali, tumetii amri zote tumeambiwa na county government na national government, vile maisha inakuwa na vile imesemekana watu wakae nyumbani.
My message is very simple. Stay home. Hakuna mambo ya mchezo, hiyo ndio msimamo wa serikali. Stay home, kaa nyumbani.
This happened as Narok Governor Samuel Ole Tunai flagged off 100 tanks which will be kept in public places for use by residents to wash their hands in order to avoid contracting the coronavirus. And learners are grappling with new challenges as government measures slapped to contain the spread of COVID-19 continue to bite. The constraints include easy access to smartphones and prohibited information. KBC County Education Board Chair Professor Henry Onderi is advising parents and teachers to prepare their children despite the difficult circumstances they found themselves in.
The teachers have no reason why they should lie idle at homes. They must make use of this time well by looking for work for their children and send this work online and receive the work online and mark and of course give the feedback to not only the parents but also the children.
Beatrice Gatonyenge-Tich, Channel 1 News.
At Malindi Police Station, the Kenya Red Cross team is in the process of disinfecting, fumigating and sanitizing the facility in efforts aimed at curbing the spread of the coronavirus. The initiative, spearheaded by Kilifi County Government and the Kenya Red Cross Society, will see all public spaces such as police stations, prisons, markets, public resting furniture, bus stops and other areas characterized by high populations disinfected. The society donating 400 hand washing units and sanitizers to be used within public areas.
Kwa wiki hii tumepeana collapsible jerrycans ambazo hizi zinasaidia katika kuweka maji na watu waweze kuosha maji, na tumeweza kupeana pia sabuni katika sehemu ambazo kuna mkusanyiko wa watu wengi. Na ni imani yetu kwamba ikiwa hili litafanyika basi pengine tunaweza kupunguza uambukizanaji wa virusi hivi vya corona virus.
Regional Coordinator Hassan Musa says there is need for sensitization campaigns on the virus, within Kilifi being one of the hotspot areas.
Kwa hiyo tunasisitiza tu jamii kwa sasa hivi tukae nyumbani, na wale ambao inabidi waende kazini basi waende kazini, lakini wakifuata utaratibu uliotolewa na serikali kuu na serikali za county.
At the same time, the organization has launched psychosocial support services through mobile phones.
Tuna wafanyikazi wa Red Cross ambao sasa hivi wamejitolea na baadhi ya volunteers ambao wamejitolea ili kuweza kuhamasisha watu na kuweza kupeana ushauri na saa, yani counseling kwa kutumia simu.